Hello everyone, I am Dr. Ghanee. I am an oral pathologist. Today I'm going to share with you a very interesting case. In my previous video, I talked about hyperplastic candidiasis, which means sometimes we have yeast infection in the mouth, and that yeast infection, when it's long-lasting chronically in the mouth, it can cause tissue growth. In my previous video, I mentioned when we have callus on our fingers, we touch it, we can tell it's thick, we can tell tissue grew there, but the color of it is like skin color. But in the oral cavity, whenever we have overgrowth of tissue, especially when we're talking about the surface mucosa, when there is overgrowth of surface mucosa, is always white. As you can see, this is back of the throat of a 75-year-old guy. So definitely we have overgrowth of tissue here. And we learned that candida, long-lasting candida infection in the mouth can cause tissue growth. At the same time, when we look at it, we see a lot of fishnet appearance here. We talked about it in previous videos. When we see that in the oral cavity, this kind of lacy pattern, it's either autoimmune or it is called lichenoid reaction. Lichenoid reaction means when we are sensitive to certain thing, some exogenous factor like food, oral hygiene product, or dental material. So basically, when we see this fishnet pattern, it means that patient is sensitive to something that his mouth is exposed to. And at the same time, we have lichenoid reaction with hyperkeratosis, which means we have lichenoid reaction and we have thickening of mucosa. The case is interesting because just sensitivity to something that patient is eating can cause lichenoid reaction with thickening of mucosa. And as we remember, the fungal elements, the candida, can cause thickening of mucosa. I did cytology for this patient, which means I checked him for fungal elements and it was positive. So basically, fungal elements are changing the mouth. They have caused some kind of thickening or hyperplastic changes. At the same time, we see patient is sensitive to something that his mouth is exposed to. So this case is lichenoid reaction and also fungal infection, and maybe one or both of them, they have caused thickening of mucosa. I did everything for this patient. I gave him antifungal rinse. We tried to eliminate anything in his diet that could possibly cause this, but with just treating with antifungal, the features got milder, but it never went away. I have been monitoring him. As you can see here, you can see again that lacy pattern of lichenoid reaction. And here you see hyperkeratosis or thickening of mucosa. I've been monitoring him and still he's showing mild features like this. This case was interesting because it was a combination of two conditions. Both of them I have talked about in previous videos. Thank you so much for watching. Have a good day.